Hello and good evening, everyone. Let's get to this presentation on psychosocial risks in healthcare. Before that, I would like to bring you to a scene from a movie many of us know, The Inside Out. In that movie, emotions are characters fighting quietly inside a person's mind. Joy tries to stay strong. Fear keeps sounding alarms. Sadness waits silently in the background. Now, imagine this happening not inside a child, but inside a nurse, a doctor, or any healthcare workers. A nurse may smile at a patient, but internally, fear is asking, what if I make a mistake? Exhaustion whispers, I cannot do this anymore. And silence says, no one must know I am struggling. This is what psychosocial risks in healthcare looks like. Not always visible, but deeply human. When we talk about occupational safety, we often think about sharp injuries, infections, or physical hazards. But the greatest risks in healthcare today are sometimes invisible. Burnout, emotional exhaustion, moral distress, chronic stress, workplace bullying, compassion fatigue. Healthcare workers spend their lives caring for others. Yet, many are silently carrying emotional burdens that slowly affect their well-being, performance, and even patient safety. A tired healthcare worker is not only an individual issue, it becomes a healthcare system issue. Because when emotional pressure accumulates, communications weakens, empathy declines, mistakes increase, and talented professionals leave. Behind every healthcare system statistic is a human being trying to stay strong while caring for everyone else. Sometimes healthcare workers become like superheroes in movie. The world sees Wonder Woman, Black Panther, or Iron Man. Strong, capable, resilient. But even superheroes reach a breaking point. In many healthcare settings, there is an unspoken expectations. Be resilient. Keep going. Don't complain. But resilience should not mean suffering in silence. Healthcare workers are not machines. They are humans who absorb grief, trauma, fear, death, uncertainty, and emotional pain every single day. And after the pandemic, many healthcare professionals returned to work carrying invisible scars. Some lost colleagues, some lost confidence, some lost hope. Yet, many still work in healthcare systems every day with compassion. That is not weakness. That is extraordinary courage. So, the question is not, are healthcare workers resilient enough? The real question is, are our healthcare systems compassionate enough to protect them? Psychosocial safety must become part of occupational safety. This means supportive leadership, psychosocially safe workplaces, manageable workloads, anti-bullying cultures, access to mental health support, and creating environments where asking for help is seen as a strength, not failure. Because when we protect emotional well-being of healthcare workers, We also protect patients, families, and entire healthcare systems. A psychosocial safe healthcare worker provides safer healthcare. I would like to end with this thought. Every day, healthcare workers help others survive physically. But who helps healthcare workers survive emotionally and mentally? Perhaps the future of healthcare is not only about advanced technology or smarter hospitals. Perhaps the future of healthcare begins when we finally decide to care for the caregivers. And for me, my time is out. Thank you very much.